Hi everyone, I'm Anthony DiRienzo, and I just wanted to talk about a growing problem in our world today. The misuse of addictive medicine prescribed by doctors to the elderly is slowly becoming a terrible epidemic due to many factors. From ignorantly taking medication or skipping doses or mixing the medicine with alcohol, adults may misuse drugs without even realizing it. This misuse becomes abuse as withdrawal symptoms become almost unbearable, forcing the older adult to continually take the medicine. As the prescription of highly addictive drugs continues to affect many, the United States government has begun to enforce state laws in an attempt to regulate the distribution of these drugs. Some states have developed prescription drug monitoring programs, along with being more strict in licensing and regulating pain clinics. The use of alternative therapies may also help lessen the need for prescription drugs. Older adults continue to misuse prescription drugs at an increasingly high rate, requiring alternatives or stricter government regulations on such medicine, also requiring us, as people affected by this as well, to become more knowledgeable. So, for the past 10 years, my Uncle John had been limping around his house due to a knee injury that he got while playing basketball with some old college buddies. Now he's 60, or a couple years ago he was 60, and he just finished surgery to replace his kneecap, and he was in excruciating pain. To relieve some of this pain, my uncle's lifelong doctor had prescribed him Percocet to take while he finished rehab to make his road to recovery a little bit more bearable. Months after his rehabilitation, he concluded, and my Uncle John was still taking the Percocet religiously. He told his doctor that he still had pain and he couldn't even bear it when he stood for long periods of time. Unfortunately for my Uncle John, that pain had just become psychological, and even though his body no longer needed the Percocet to function, his brain was telling him otherwise. He'd become addicted. The original problem, of course, derives from not only misuse by the patient, but also the prescribing doctor. Dr. John Culberson and Dr. Martin Ziska of the Baylor College of Medicine in Houston described in an article entitled Prescription Drug Misuse and Abuse in the Elderly that the abuse of prescription drugs not typically involved the substances just to get high, but the users usually obtain them not even illegally. They go on to say that instead, unsafe combinations or amounts of medication may be obtained by seeking prescriptions from multiple doctors. This was also known as doctor shopping, by obtaining medications from family members or by peers, or even stockpiling their medications over time. From a patient's standpoint, on each bottle of the prescribed drug, there are directions on how and when to use it. Misuse takes place when the patient still feels pain and decides to even take more of the medicine than what's told in the bottle. On the other end, if the patient misuses dosages or forgets to take the pill, they begin to have extra medication or they tend to hold on to the drug excessively. Misuse also occurs when the patient does not read the warnings on the bottle. A situation like this could develop by taking the prescribed medicine and then drinking alcohol or even driving. With very potent drugs, these actions are very hazardous and sometimes even deadly. Inappropriate prescribing can happen with any doctor who has had a patient for a long period of time. While a doctor wants to please their patient and keep a good relationship together, they must be careful with their prescriptions, as people could exaggerate the pain or the stress that they're in or under. Patients may also feel like they need a particular drug, which may be very addictive, when the doctor may be even able to give them a drug that's not addictive at all. Either way, a practitioner must make sure that they stay on top of their patient's use, making it mandatory to keep track of how many pills their patient is taking daily, weekly, and on a monthly basis. This could help ensure the minimal misuse by the patient and the doctor. As the patient continues to misuse their prescribed medication, the chances he or she begins to abuse and develop a dependency for the drug greatly increases. As a patient's body develops a dependency for a certain drug, their body begins to decline physically and may create tolerance. This is especially sustainable to older people. As a person's tolerance increases, it requires more potency to have the similar effect that the mind and the body is looking for. This creates a constant everyday struggle for the patient to have the drug just to perform regular activities. Dr. Culberson and Ziska also warn that in some cases, withdrawal symptoms can be so devastating that a patient can have seizures and other serious medical conditions that may require hospitalization. Along with this, a person often has deteriorating conditions as they age, regardless of drug use. It is common that the elderly develop memory loss, slow motor skills, and blurred vision, which can increase or be the actual cause of drug abuse, not just that of old age. As numbers continue to rise, it's clear that patients, doctors, people who see these patients every day, like us, and the government as a whole must take the appropriate actions to ensure that the elderly are not abusing their prescription drugs. So how can we do that? One way an attempt has been made to track down how many doctors a patient may receive prescription from is through prescription drug monitoring programs, or PDMPs. These are programs run by the state that holds on to highly addictive and coveted drugs while also being in charge of their distribution. Generally speaking, a doctor could use a PDMP to find out if a patient, new or old, is seeking addictive drugs, or if he's already been prescribed by other doctors. In 2012, Julie Worley wrote an article entitled Prescription Drug Monitoring Programs, and she quoted a published government-sponsored report which said the presence of the PDMP reduced supply and abuse of Schedule II opioids, and proactive programs had a larger impact on this reduction than reactive programs. By this information, it's clear that when used, PDMPs are extremely effective. Unfortunately, PDMPs are set up differently in every state they apply to. In regards to who can have access to these programs and when they should be reported varies by state. This information shows that even though PDMPs are not used in every state, it's a step in the right direction, one that we need to keep up. Licensing and regulating pain clinics is another way states are beginning to strengthen their cause to help fight the misuse and abuse of highly addictive prescription drugs. Pain management clinics are places that people with chronic pain go in an attempt to learn how to manage their pain and live effective lives daily. While there are all types of doctors and physicians who work at these pain clinics, many of the clinics have their patients on many drugs instead of finding alternative ways to handle their everyday pain. As the regulation of these clinics continues to get stronger, there are still many pill mills or corrupt pain management clinics that must be shut down altogether in order to grasp a better hold of the misuse of prescription medicine. Fortunately, it does seem as though some of the state laws are beginning to have an effect on pain management clinic. However, we need to do our part to make sure that all of them get shut down. Doctors should also focus on alternative medicines or procedures away from highly addictive drugs to prescribe to patients so addiction doesn't become an issue to begin with. One example of an alternative procedure is acupuncture. Acupuncture is the use of needles to prick your skin or tissues in an attempt to reduce pain and treats physical as well as mental symptoms. Unfortunately, in most cases, doctors tend to prescribe medicine instead of looking at the alternatives. It's not fair to propose an idea of eradicating pain medication altogether. However, a lower dose of pain medication, along with an acupuncture treatment, has been proved to generally relieve the pain that a patient feels. Acupuncture is a great alternative. Another main type of alternative medicine that's been around for years and people are always using are herbs. People today use herbs for all types of illnesses. Some tea leaves are used to reduce symptoms of a cold, while some fruits and berries are believed to reduce the risk of cancer. Ever heard of the phrase, "an apple a day keeps the doctor away"? Exactly. Alternative therapies need to be considered going forward in an attempt to reduce the amount of elderly patients becoming addicted to prescription drugs. Since the world has become aware of the increase in drug abuse and addiction, the government and state laws surrounding the prescribing of these drugs have begun to come into play. Unfortunately, enough has not been done yet with the actual prescribing habits of doctors. Miles Schreiner from the American College of Legal Medicine just 2 years ago told us that some of the main reasons for the rise in drug abuse were significant increases in the number of prescriptions doctors are issuing. Since this is a problem that has been developing for the past 2 decades, why in 2012 was this, of all reasons, still a major factor? What are we doing about it? I'd like to imagine a world for not only my uncle, but for anyone who's dealt with the problem of abuse and drug misuse with a family member where there's a different route they could have gone. For my uncle's circumstance, I would have loved to see him go to physical therapy more, or his doctor to just say no to more drugs, or attempt to wean him off of the drugs instead of just giving in to his demand. He would have been offered something along the lines of acupuncture or some type of herb. I like to think that he would have been in this situation, or maybe not. Better yet, if someone in the family was educated enough at the time to realize the warning signs of this change in behavior, or the fact that his life was revolving around these drugs, would he even be in this situation today? I'm not sure if I can answer that question. But looking at this right now, what can I tell you? This is a problem that's only going to get worse if we don't take the steps to take charge in changing it. I challenge you to look for the early warning signs of drug abuse and challenge your doctor to do something else. I challenge the government to become more strict with allowing doctors to provide with those drugs so easily. The little things are what's going to turn this dilemma around. It's clear at this point that the misuse and abuse of addiction medicine has become detrimental to the elderly population. Doctors are continuing to prescribe these highly addictive painkillers at an increasingly high rate. And while some are doing it because they feel it's in their patient's best interest, they're continuing to hurt them in the long run. Some prescribers run into problems of doctor shoppers, while others run into loyalty because they've been with their patient for such a long period of time, both of which are difficult situations for a doctor to overcome. However, laws must be made and enforced by not only the government, but by the states and us individually. Drug monitoring programs and more strict licensing and regulating pain clinics is a good start, but the enforcement of these laws is what's going to be important. Alternative therapies and medicine must also become mandatory through state laws to take the pressure off of the doctors. While older adults continue to misuse prescription drugs, more strict government regulation and alternative therapies must be put into effect. This is a problem, but it's a problem that can be changed with our help. Thank you for your time.